Thank you all for coming. For those of you who don't know, my name is Joe Cable. I'm the director of MindCORE, and it's my pleasure today to introduce our MindCORE speaker, who is Allie Sinclair. Allie is the Joan Bossert Postdoctoral Fellow here at UPenn, working in the Communication Neuroscience Lab and in the Annenberg Public Policy Center. She came to us from Duke, where she finished her PhD working with Greg Samanas-Larkin and Allison Nadcock, thank you, and has done some great work here at Penn, including over the last 6 months, documenting both the nature of federal funding cuts and the economic impact of those federal funding cuts, and working on what are some interventions that are effective in making people aware of those impacts. And it's that work that she's going to tell us about today, and I am delighted and very excited to hear about it. I'll hand it over to Allie.
Thank you, Joe, for that introduction. Happy Halloween. Hi, everybody. Today I'll be talking about the indeed spooky, scary topic of science funding cuts, but hopefully with a more positive and actionable spin on it, as we'll think about what we can do to address this crisis and motivate people to take action, both sort of collectively as a scientific community and as individuals. A little bit about me before I jump in. As Joe mentioned, I'm currently a postdoc here at Penn. I will be starting my own lab at Rice next year. So if you're interested in learning more about what I do and how I do it, you can check out my new lab website here. I am a cognitive neuroscientist by training, but the focus of my work is really bridging basic science insights about how the mind and brain work to real-world applications to help us tackle challenges including pandemics, climate change, or the spread of misinformation online. And today I'll be focusing on one application domain that I didn't expect to be working on a year ago, but here we are today. Now, I'm sure I don't need to emphasize to this room that science funding cuts have been a problem this year, but just to walk us through a bit of a timeline of what occurred, back in February, we saw the NIH announced a new policy that would essentially slash infrastructure support for science. So this would cut what is known as indirect costs for research, which support things like, keeping the lights on in buildings, shared resources, ethical checks, IRB review, all the things that are useful and needed to support research, particularly biomedical research, and are often pooled across many projects in many labs. We then saw an increase in cancellation of grants, so individual research projects that were being targeted and terminated, either because of keywords in those grants that conflicted with the administration's new priorities, or in some cases because institutions like Penn were directly targeted and all grants that could be canceled, regardless of subject matter, were being canceled. And more recently, we've seen that the White House proposed unprecedented budget cuts to U.S. science, including proposing slashing the NIH budget by about 40% and the NSF budget by over 60%. Now, many of these changes continue to be blocked or contested in courts or discussed by Congress in the case of these budget cuts. But I want to emphasize that these things aren't pending. We're already seeing that the damage has been done. For example, the cancellation of NIH grants has led to clinical trials being halted. That has direct implications both for researchers and for the patients who were involved in those trials. And we've also seen the consequences that occur for academic science as a community, and particularly our training pipelines. We saw in the spring that there were hiring freezes at many universities, impacting new faculty positions as well as lab staff positions. We saw that graduate school admissions were greatly reduced at many institutions. And we see also the elimination of many opportunities for students to take their first steps into research. For example, summer programs that support students from underrepresented backgrounds. And so even though these changes continue to evolve from day to day, and many of them have not been fully realized in the way that the administration might have intended, we're still seeing wide-scale devastation as a result. Now, I know this seems all very negative, but as I said, I will try to make this a more positive and actionable talk, thinking about what we can do to address this crisis. To sum up this background here, in the US, we've seen both current and proposed cuts to federal science funding that will have negative consequences not only for research, as I just shared, but also for healthcare in the longer term and more immediately for local economies. And that's a point that I'm going to emphasize quite a lot today. These cuts include grant terminations and reduction in funding for indirect costs or research infrastructure. There are other cuts and other budget proposals that are relevant, but I'm going to focus on these two sources of losses today. And I want to emphasize that these changes are particularly surprising in light of the fact that there's actually quite a long history of bipartisan support for science funding in the US. Although perhaps we can contextualize this by understanding that there are some longitudinal trends, for example, from public polling data, that have shown that over the past few decades, we're seeing increasingly politicized attitudes towards science in the US, with a growing partisan divide where among Republicans there is increasing distrust of science or reduced support for scientific endeavors. Now, I want to emphasize here that these cuts are particularly surprising because investing in science is clearly good for the US economy. For example, in this report that was conducted by the United for Medical Research Coalition, where they looked at the economic impact of investments in NIH awards in the year 2024, they found that every dollar that's put out into research projects through NIH awards leads to about $2.56 in return of new economic activity. So that can be the result of research generating new innovations. It can be creating jobs that support the people who work on that research. It can be through the sale of goods and services that contribute to the research, or simply the way that scientists lead their lives. As many of us know, we sometimes move across the country to new places solely to work in a particular research position. We now belong to that community and give back to that community as individuals. And so through all of those different ways, investing in science is actually beneficial for the US economy. And thus, if we flip that on its head, we can infer that cutting science funding could lead to downstream consequences for local economies nationwide. And this is a point that we've made before in some of these recent papers and commentaries, in which we argue that we should shift our focus from thinking about individual elite research institutions that are impacted to also visualizing and considering how these cuts to science funding will have effects on communities across the US. So, what do Americans think about all these funding cuts? Well, polling data suggests that people have rather mixed and uncertain opinions about it. For example, in this poll that was conducted earlier this year, they asked about a couple of types of changes that were happening. The first was suspending or terminating NIH grants, and the second was pausing the award of new NSF awards. I want to note here that at the time that this poll was conducted, there weren't grant terminations happening for NSF grants, which is why they're focusing on pausing of new calls for funding as opposed to cancellation of existing grants. But regardless, you can see that this pattern is pretty consistent. So in gray, you can see that a little bit under half of people disapprove of the cuts that are occurring, but around 30% are unsure what to think. And an appreciable number, nearly a quarter, are approving of these cuts. They believe that these actions should be taken. And yet we know that public understanding of these science policy changes and the downstream implications of them may in fact be limited. And as we're seeing here, there's quite a lot of people who aren't sure what to think. They might not know much about it. So what can we do to address that challenge and try to close that gap? Our team thought about how we could draw on insights from the mind and brain to develop evidence-based interventions that could communicate this impact of science funding cuts and change attitudes and thus motivate action. We drew on evidence from across domains. To briefly summarize here, we know that, for example, people are quite averse to losses, so learning about potential losses biases decision making. We know that active engagement with a task or information could increase the depth of processing, which might increase the persuasiveness of that information or make it more memorable over time. From other studies, we've seen that surprising feedback or prediction error can drive belief updating and learning. And we also know from a separate domain that self-relevance of information influences valuation and motivates sharing. So for example, if I perceive that some information is relevant to me and my own life or people that I know, I'm more likely to engage with it and more likely to share it with other people. So in these studies, we asked whether we could develop informational interventions that could tell people about what's going on with these science funding cuts and actually meaningfully change attitudes, particularly across the entire political spectrum. And I want to note here that this wasn't our first time doing something of this nature. This project was born of some of our prior work that we conducted during the pandemic. We previously developed some interactive online tools to help communicate local COVID-19 exposure risk in your community and measure how engaging with that information might change beliefs about risk and intentions to engage in potentially risky activities in everyday life. And we had really great public response from this outreach effort. We had over 16 million people who engaged with our website and learned about COVID risk. These are not paid participants, but people who voluntarily sought out this information and wanted to learn about it. If you're interested in learning more about it, you can check some of our prior papers that came from this effort, where we show that we can scale interventions that are validated in lab samples to these public-facing websites that can reach much broader audiences. And so here we took a similar approach. We developed a website that we call SciMap, which stands for Science and Community Impacts Mapping Project. Our mission broadly is to communicate the local and national impact of science funding cuts. And you can check it out here. It's available on mobile or on desktop if you scan this QR code or go to the URL scienceimpacts.org. Feel free to pull it up if you'd like to, but I will also in a moment share some screenshots so that you can see what it looks like without getting too distracted. And I will show that URL again at the end. Okay, so when users arrive at our website, we first show them a message that gives them a bit of context about what the NIH is and what it does, and what's happening with these cuts to science funding. We then go on to tell them a little bit more about two specific kinds of changes that have been implemented. What we call current losses are the impact of terminated grants, as these were active projects that were already canceled or frozen. And then we also refer to future losses as the estimated downstream impact of this proposed cap on indirect costs of research. Essentially, that would limit funding for research infrastructure, taking a chunk out of every current grant and every future grant. And so we model the projected downstream impact of those future cuts. After we provide this explanation, participants have an opportunity to interact with this color-coded map of the United States. These red-toned regions across the US are showing at the county level estimated current and future losses that would occur as a result of these funding cuts. And these blue bubbles here indicate the number of terminated grants within a region listed by institution. Users can interact with the map by hovering over it. They can also click this button down here to zoom into their current location to sort of immediately get to their local area. And they can also interact with it by selecting the region type up here. So I'm showing county, which is the default view, but we also show it by state or by congressional district. Zooming in a little bit here, if you were to interact with this map as a resident of Philadelphia, you might want to zoom into Philadelphia County, where you could hover over that county and see this tooltip that tells you about current and future losses. And you could also click on this blue bubble right here to see the number of terminated grants listed by institution and the dollar value associated with losses from those grants. Now, you might be wondering how we designed this website, how we made these decisions, and most importantly, does it actually work? So what I hope to answer today is to tell you the story of how we first tested this experimentally to inform the website design, and I want to share some exciting evidence indicating that it can indeed meaningfully change attitudes and motivate action. With that, I'll transition into this next phase where we'll shift gears and go a little more sciencey, where I'll share some of our empirical studies that we've conducted. We first conducted two pre-registered online studies where we tested informational interventions that communicated the projected economic losses that might result from NIH funding cuts. And I want to note here that we chose to focus on this economic loss framing as we thought that it might be compelling, particularly across the political spectrum for both liberals and conservatives. In these studies, we recruited samples of US participants that were stratified by political ideology, age, and gender to approximate the demographic makeup of the United States. So these are politically balanced samples. In study one, we had nearly 3,000 participants in 10 different groups. I'm not going to go into great detail about all of our different groups, but in brief, we tested a number of different intervention versions to try to find which ones were most effective, and we compared them versus a control condition. We varied a few different variables, including the task format, so whether we presented information in the form of plain text or with an interactive quiz, the information scale, so whether we displayed statistics about the US as a whole or one specific state of residence, and finally, we varied whether we provided anchoring information about prior funding norms. So do we tell people about how much in prior years their area has received in terms of NIH funding before telling them about these losses? In study two, we took a similar approach. We had about 2,500 American adults in this sample and about 8 groups in total. We again varied task format, but with a twist. So we still have a text only condition for comparison, but now we've introduced our interactive map, just like what you see currently on the live public facing website. And we also varied the loss metric that we presented. So we expanded to compare multiple different types of losses. As in study one, we share information about indirect cost losses, but now we also expanded to include information about terminated grants. And we varied whether we presented just one of those metrics, both of them separately, or both of them summed together to try to make it easier numerically for people to understand. Now, I'm underlining task format here for these two. Spoiler alert, in general, all of these interventions were similarly effective, but we do see some interesting differences emerging when it comes to task format, so I'm going to focus more on that today. But for the most part, I'm going to be combining the intervention conditions as they were generally very similar. A quick overview of this study. Before we exposed participants to one of these different treatments, we measured 3 things. First, their approval of these funding cuts that were related to science in the US. Second, self-reported knowledge of those funding cuts. And finally, perceived local impact. So how much do you think these funding cuts would have positive to negative effects on your local area? We had a control condition where participants read a neutral passage of text that was either about science or about health, did not mention the NIH, the Trump administration, funding cuts, anything of that nature. We picked it to be pretty emotionally neutral, fairly boring, and matched in terms of length and complexity with the intervention text. Here I'm going to focus on the different task formats, but among our intervention conditions, in both studies, we've got a text-only condition where we just provide a passage of text that gives information about the economic impact of NIH cuts. And then we had some other conditions that augmented that text with some sort of interactive intervention. So in the text plus quiz condition, after they read the text, we had them guess the economic loss for their area or for the US, and then we revealed feedback after they guessed. And in the text plus map condition, after they read that text, we had them interact with the dynamic map that you can see today on the SciMap website. And I just want to emphasize here that we're conceptualizing these two intervention groupings as representing different kinds of active engagement with the information, whereas the text-only information does not have that active component. After completing one of these different treatment conditions, we measured approval, knowledge, and local impact once again. And then we also had a longer battery of other outcome measures, including action intention. So how much do you intend to take action to voice opposition to these funding cuts? I'll talk more about that later. We had a number of secondary outcomes, including perceived impact for yourself or people you know, sort of trust in science or perception of scientists more broadly. We had demographics, and most importantly, we measured political ideology at the very end. We do have a balanced sample, and we're interested in moderating effects of political ideology, but we don't want to prime them to have that identity ready right at the beginning of the study before they engage with this information. Okay, zooming into our different intervention formats, these were a little different from study one to study two. In study one, the text intervention focused on the losses that would result in the future from the proposed cut to indirect costs of research. So you can learn more about that here. This is truncated. In total, it was about 3 paragraphs long. And in the quiz condition, we extended this text information by having them first type in their numeric guess for how many dollars would be lost, and then we revealed the feedback and contextualized that with some more information. This varied across conditions, so some participants guessed and then saw feedback for the national level and others for their state of residence. In study two, we again had a text-only condition, which was similar to before, except now that we've extended this to include information about canceled grants in a region in addition to indirect cost losses. And we paired this now with dynamic free exploration of that interactive map. So participants saw sort of a toy version of that map. They didn't just go to the public website. This was embedded within the Qualtrics survey so they could explore. We had them interact with it or at least sit on the page for at least 1 minute before continuing with the survey, but we didn't force them to do anything. We said, you can engage with this however you like to. Some people spent considerably more time with that, interacting with it. And as I mentioned before, they can hover around, they can click on things. There were other tabs where they could read more information and so on. And so this was very much a sort of free-form exploration. Finally, the third study that I'll share today is an analysis of naturalistic website user data from the public-facing SciMap website that you saw previously. So we took the leading strategies that we identified in our empirical studies and we scaled those to this public-facing website. The website, as it currently stands, features multiple maps that show different kinds of impact, an interactive quiz, as well as informative text about the funding cuts and information about us, the creators of the project. We've had over 200,000 unique visitors since launch. That stat's a couple of weeks out of date, so it's probably a bit higher now. And we analyzed naturalistic browsing data from about 24,000 users who visited the website during a 3-month period. From these users, we get a number of different metrics, including their engagement time on each page of the website, detailed information about the actions that they're taking, like the clicks that they make on the map. We have sharing information. So you'll notice here it's a bit small, but there's a sharing button where you can share out the website on various social media platforms or directly with someone via email. So we have information about who is clicking on those sharing buttons and in what way they chose to share. And finally, for people who complete the quiz that's available on the website, in addition to their estimates of losses and their feedback, we also collect measures of approval of the funding cuts pre and post quiz. Turning to our results, I'll be highlighting some findings from across our different studies, starting first with the empirical controlled work that we did with our paid samples. First, focusing on our 3 primary outcomes: approval, knowledge, and perceived impact. On the x-axis here, we'll look at study 1 and study 2. I'm just plotting them side by side for easy comparison with this replication. And on the y-axis, we'll look at the within subjects change in a particular measure, so comparing somebody's post-intervention response with their pre-intervention response. In teal for all panels here, I'll plot the control condition for each study, and in the orange dots, I'll show the intervention conditions grouped together initially here. As I mentioned, they had quite similar effects. This dotted line at 0 here would indicate no change from baseline, so there was no effect of the intervention. Okay, and what we found was that across 2 of our studies here, we see that the intervention conditions in orange significantly decreased approval of the funding cuts relative to control. We see that they also substantially increased perceived knowledge of the funding cuts and led to perceived negative impact for one's local area. To sum up, we see these effects across the board in terms of within-person changes. You can see the effect sizes there range from small to medium. And now looking at action intentions, which are measured afterwards, we wanted to see whether people might be more willing to actually do something about this, having induced these attitude changes. We looked at 3 different types of actions that people might take, whether people were willing to start conversations, talk to other people about these funding cuts, whether they were willing to contact their congressional representatives, and finally, whether they were willing to share information online, such as on their social media accounts. Same setup as before, we'll look at study 1 and study 2 down here side by side for each panel. Now the y-axis will be intentions to engage in an action. As before, I'll plot the control versus intervention conditions. And I want to note here that as we don't have pre and post measures for this, the dotted line instead marks the midpoint of the scale. So anything above the dotted line indicates that people, on average, intend to engage in that action in the future. And what we found was that across our different measures of actions, although there are different baseline effects in how much people are willing to do certain things, we see that the interventions are reliably and significantly increasing intentions to engage in those actions across the board. But next, we wanted to take a deeper dive into our data on approval and ask whether these interventions might actually be meaningfully changing minds. So what I showed you before were average effects, so pooled across all people, which includes people who already disapproved of the intervention and now maybe disapprove a little bit more. But we were really interested in whether we could actually see a change of heart among people who were initially unsure or initially approved of the funding cuts. Here, we'll look at these categorical changes in approval. I want to note that at baseline, we do already see that a majority of people disapprove of these NIH funding cuts, 69%. I'm going to show an alluvial plot here. In this column, we're looking at pre-intervention distribution of participants who fall into these different approval categories. I'm going to focus only on the intervention conditions here as we're interested in change. We see that the majority of people, over 3,000 across our 2 studies, disapprove, but a meaningful number approve or are unsure. I'm going to color code these flows here according to baseline approval status so we can keep them clear. As we shift from pre to post, we see that a majority of people continue to disapprove, and that number has gone up by 9%. But we also see some interesting effects when we look at where those flows go. So you can see here in red that the vast majority of people who disapproved initially continue to disapprove. There are small rates of backfire of people moving in the opposite direction, but this is about 1% per condition, no more than we might expect randomly from just general sort of test retest unreliability. Now, there's much more movement, relatively speaking, happening from these two categories here. But this is a bit small, so let's zoom in to see what's going on in a bit more detail. Zooming into the approve and unsure categories, so these are people who did not already disapprove of the funding cuts at baseline. We see that among people who initially approved of the funding cuts, an impressive 26% of them have switched to disapprove after the intervention. So this is a total change of heart, moving from one end of the spectrum to the other and crossing that midpoint. In addition to that 26%, an additional 11% are now unsure, indicating another sort of categorical shift in how people are thinking about these funding cuts. Looking at the, and the rest of them predictably are remaining in the approved category as there's nowhere else for them to go. But looking at the unsure category, we see that a substantial 46% of them have switched to disapprove post-intervention. So nearly half of them now disapprove after learning about the impact of these cuts, whereas the rest of them mostly continue to be unsure. So overall, we see this promising evidence that these interventions can lead to substantial categorical shifts in approval, in addition to those small to medium effects that we see on the average level when we look at how much people are moving in terms of points on a Likert scale. But this we think is really exciting and indicates that there can be meaningful changes of heart. Now, you might be wondering whether these effects differ depending on political ideology. So we took a look at that here. First, we'll look at the average changes in approval according to political ideology. I'll be comparing pre versus post-intervention measures. These are connected for each participant. And on the y-axis, we'll look at the approval of NIH funding cuts. This dotted line here indicates the midpoint of the scale, so values above the dotted line indicate approval, whereas values below indicate disapproval. And finally, I'll be plotting 7 different lines that indicate the different levels of our political ideology variable. And these are self-reported, so these are people who self-identified as extremely liberal or extremely conservative or somewhere in the middle. First, looking at the conservative and moderate participants, you'll notice these negative slopes. I'm focusing on the intervention conditions here. So you'll see that these negative slopes indicate that on average, from pre to post-intervention, participants are reporting decreases in approval. That's consistent with what we saw previously when we looked across the entire sample, but it's exciting to see here that even at the level of extremely conservative participants, we're still seeing these downward slopes. If we look at the liberal participants, you still see this effect, although you'll actually notice that it is a little bit shallower, and that's because the people who are extremely liberal don't really have much room to move. We're seeing a floor effect here where they already strongly disapprove. So overall, we're seeing these post-intervention decreases in approval observed across the political spectrum. And in fact, that interaction is significant. So we actually see slightly greater decreases in approval for conservatives in our sample, which is consistent with the idea that they have more room to move and goes against the idea of backfire for conservatives. The last set of findings I'd like to share pertains to this idea of active engagement. So now getting into those different intervention types, do we see differences? We found that there were interesting effects when it came to intervention type in terms of motivating action. On the x-axis here, we'll compare the intervention format. In study 1, that was text versus quiz, and in study 2, it was text versus map. Looking at action intentions, we find that in both studies, participants who completed one of these interventions that involved active engagement of some kind reported greater intentions to go on and take action in daily life, as opposed to those who completed a text-only intervention. And this is particularly interesting to us because we found that the text-only interventions were actually just as effective at changing approval ratings, but we see the selective effect of active engagement potentially going further to help motivate people to take action. In study 3, we also looked at the real-world data from people who came to the website of their own accord. We have about 2,000 quiz submissions in our data set here from people who visited the website. Here's a screenshot of what that quiz looks like as it's implemented on the website. So at the beginning step here, you would identify what state you live in and provide a pre-quiz rating of your approval. We then have people submit guesses for canceled grants and indirect cost losses, and then we reveal feedback at the end and once again ask about approval. Just briefly summarizing findings from the quiz here, replicating our prior work in the intervention studies that were controlled in the lab, we see a significant decrease in approval of funding cuts from pre to post quiz. And we also see that prediction error is associated with greater changes in approval. So people who more severely underestimated losses for their state report greater decreases in approval after they receive feedback. But what about the effects of interacting with the website? Now we're going to compare findings across study 2, where we had the map conditions, and study 3, where we looked at the real-world data from users in the public-facing website. In study 2, we've got a number of different outcomes, so approval, knowledge, and action intentions. And in study 3, we'll look at actions like whether people decide to take the quiz and whether they click on those sharing buttons to actually share the SciMap website with other people. And what we found was that across studies and across outcomes, the amount of time that people are actively engaging with the website predicts these different outcomes. So more interaction time was associated with greater decreases in approval, as well as greater increases in knowledge and greater action intentions at the end. And shifting to the real website data in study 3, we see that people who interacted more with the website were more likely to take the quiz and more likely to share the website with others. And I'll also note here that people who did take the quiz were then substantially more likely to share the website after they completed the quiz. So taken together here, this indicates that there's some converging evidence across different measures and across our 2 studies here, showing that the more people are showing this active engagement with the website and with this dynamic map, the stronger the intervention effects. In the last part here, I'll summarize across these studies, and then I'll shift gears to talk about ways that we as individuals can contribute to these efforts and take action in daily life. So to sum up findings across our studies here, we show that the interventions decreased approval of funding cuts, increased knowledge and perceived local impact, and also increased action intentions. We see that these interventions led to substantial shifts in categorical policy approval. And finally, we see that across outcomes and studies, more active engagement, particularly with the quizzes and maps, was associated with greater intervention effectiveness. Few discussion points here. As I mentioned, we see that active engagement seems to be selectively more effective at motivating action to oppose the funding cuts. We find that these interventions were effective across the political spectrum in these nationally representative, politically balanced samples, and we don't see any significant backfire effects that are related to political ideology. But it is important to note that we do see political differences as expected. So for example, at baseline and post-intervention, conservatives report higher approval than liberals do. And we also see that action intentions are lower for conservatives than for liberals, which might be related to the kinds of action items we selected, as they all involved sort of publicly voicing your opposition to these funding cuts, and that could be impacted by social norms. Finally, our findings indicate potential dose-dependent intervention effects. So the more time you spend interacting with this website, the stronger the effects that we see across outcomes and across studies. To highlight some future directions, as this is very much a living project, we're interested in the effect of narratives. So for example, by telling personal stories of impact from scientists or clinical trial participants, could that potentially enhance the effectiveness of our interventions? We're interested in comparing this economic loss framing with other strategies, for example, focusing on health impacts or focusing on American leadership and innovation. We've also recently developed some informative and promotional videos about our website. So we're interested in how video interventions might potentially have similar effects to this active interaction, as these are easy to scale, for example, on social media. Speaking of social media, we're interested in how we can run ad campaigns to motivate information seeking, inviting people to learn more about this issue, and whether we can see any effects like this just with brief information exposure, for example, with an ad you might see on Instagram. And finally, we're interested in how these effects might interact with social identity. For example, by revealing bipartisan norms, showing that conservatives, just like liberals, report decreases in approval after learning about this information, we might help overcome this partisan divide that we see. We're also interested in how we could cue social identity in other ways, for example, highlighting sports teams associated with universities that people might personally identify with to emphasize the impact of these cuts. In the last few slides here, I'll highlight some great work that others have been doing in this space and identify ways that people like us might take action if we're so motivated. Many of you have probably heard of Stand Up for Science. This was a movement that was founded by Colette Delawala, who's actually a clinical psych PhD student at Emory. Um, Stand Up for Science has organized protests nationwide. This began earlier in the year and continued throughout the summer. Their most recent campaign has involved circulating letters and petitions. And more specifically, they're currently pushing a movement to impeach RFK Jr. and oppose some of the changes that have been occurring at HHS. I can't say whether or not this approach is evidence-based, but their recent campaign involved inviting people to send their congressional representatives rubber duckies, imploring them to impeach the quack. These were actually hand-delivered by a person in a duck costume. Another example of a leader in the space is the Impact Project, which has positioned themselves as sort of a hub of resources and data that aim to empower other advocacy initiatives. You can find it at theimpactproject.org. They are curating and mapping the impact of all federal changes, not only cuts to science funding. So they're also looking at layoffs, changes to food stamps, immigration, and more. And importantly, they're also collecting personal stories. So if you have a story that you would like to share, you can contribute it online. If you go to their website, in the top right corner, there's this button, Share Your Story. And by contributing information about how these changes to the government have impacted you or your lab, you can help them build out their database and expand this resource. Another great project I want to highlight is called Science Homecoming. Some of you may have heard of it. This was also founded by early career researchers in psychology and neuroscience, and it involves scientists writing op-eds in their hometown newspapers to help show the human side of science and demonstrate the value of scientific research for society. So they provide resources and tutorials to help scientists identify target newspapers, write and get feedback on these stories, and then actually get them published. This green tinted map that you're seeing here indicates all of the stories that they have seen published, and you can click on these little home icons to see examples of news stories that scientists have published as a result. The final initiative that I'd like to highlight is SNAP, or the Scientist Network for Advancing Policy. Once again, founded by early career researchers in psychology and neuroscience. So shout out to people who study human behavior for taking action in this crisis of human behavior. And back in August, SNAP coordinated visits nationwide to help scientists meet with members of Congress in their local area and advocate for protecting NIH and NSF budgets. I want to note a positive thing here that we've seen a lot of progress in terms of the versions of the NIH and NSF budgets that have been through the House and Senate relative to the White House version. We're now seeing that most likely budgets will be maintained at prior levels for science funding, which is fantastic. SNAP has more initiatives that are planned and coming soon. You can check out their website for opportunities to get involved. And I want to highlight here that SciMap recently partnered with SNAP to arm them with some resources that they could take into these congressional district meetings. For example, we developed these scorecards from SciMap, where we looked at the estimated economic losses that would result from the proposed White House budget. And we broke this down by every congressional district and also by research area, for example, highlighting cuts to aging research, cancer research, or infectious disease research. And so we provided these scorecards to all of the people who were going out on the ground to meet with their reps so that they could bring this information into those meetings. To close here, I'd like to summarize and list some things that we can do if you'd like to get involved. You can start conversations with people in your life about science policy changes, especially non-scientists like your family. You can seek opportunities to share about the process of doing science. So, for example, although there's been a lot of work in the realm of science communication that focuses on how we can talk about the findings of our work, there's relatively little effort to communicate the process of doing science. What does it mean to run a lab? What does it mean to be a PhD student? How do you publish your work? Are we paid to publish? No, we have to pay to publish instead. Well, how competitive is the grant process? How does peer review work? There are a lot of questions and things that the public may be uncertain about, and revealing that can increase trust in science and transparency. You can also share your personal stories of impact, for example, through that initiative run by the Impact Project. You can share resources like SciMap or like the other websites that I shared today that aim to highlight local impact and communicate that to the public. You can join up with Science Homecoming to write local op-eds. And you can also attend protests in support of scientific funding and independence. Again, Stand Up for Science is organizing many of these. I know MindCORE has organized some events for people to make posters or walk over together as a group. And finally, you can also keep an eye out for petitions and open letters that are circulating, for example, in defense of HHS employees who have spoken out against these policy changes or staffing cuts. And finally, many of these groups are soliciting donations. For example, Stand Up for Science is officially a nonprofit organization. They are taking donations, and there are many ways to contribute to those efforts. Don't donate to us. We are an academic research project first, not a formal nonprofit or advocacy organization, but there are others who would be very excited to have that support. To leave you with a final take-home idea here, we show that scalable online interventions that reveal the costs of science funding cuts can change attitudes and motivate action, and we show those effects across the political spectrum. If you want to know more about the empirical work that I shared today, you can check out our preprint here. And once again, the link to the SciMap website is scienceimpacts.org. I want to give thanks to the SciMap team who made this work possible. My co-founder in this project is Joshua Weitz, who's a professor at the University of Maryland. The two of us previously led a lot of the COVID work that I shared briefly. Mallory Harris and Cleo Andrus are leading our data processing team and geospatial visualization. I'm leading the behavioral science team along with Emily Falk, Danny Cosme here at Penn, and Angie Fagerlin and Ellen Peters. Our software engineers are Colin Cook and Arun Chande. And I want to emphasize here, just highlighting in orange, that Joshua and Angie generously contributed their discretionary research funding to support the two studies that I shared today. Finally, we recently got a grant from Open Philanthropy to support continued work on this project, so thank you to them. And my effort on this has been supported by the Annenberg Public Policy Center. Thank you for your attention. I'm happy to take any questions about this work, and time permitting, I also have some discussion questions that I could put up if we want to talk about things at our round tables, but we'll open it up to broader questions first.
Where did the online samples come from?
These were recruited from Prolific, which is like an online labor marketplace. They were stratified using quota sampling to approximate national makeup in terms of political ideology, age, and gender. Yeah, Joe.
First, thank you for doing all of this work. I have two questions, both about the website.
Mm-hmm.
And so the first question is, as someone who has experience with some of the actions and cancellations, a lot of this is dynamic. So I'm wondering how much of the website is dynamic, like the grant gets stated, does that get updated on the website if new comments get canceled? So first question is it dynamic? And then the second question is, what are the assumptions you're making for, so it seems pretty clear to me to calculate economic impacts of like reducing the NIH budget, but if you're talking about indirect costs or grant cancellations, is the assumption that that funding just goes away and doesn't go back into the NIH budget, or what assumptions?
Yes, great questions. First, yes, it is dynamic. So first I'll mention for the indirect cost estimate, that's static because we're basically using the 2024 NIH reporter database to estimate what like a typical funding year might look like. And then we estimate how much would be lost if this cap were implemented. So that doesn't need to be updated. For terminated grants, absolutely, it's changing every day. We have an automated pipeline. We're drawing our data from a database called Grant Witness, which is pooling information about canceled and frozen grants across multiple sources. They update every day. We automatically refresh our data based on their website. If a grant is reported as being restored, it is no longer factored into our loss estimates. You can see there's a little info bubble at the top of the website that will mark the date that it was last updated. So even the screenshots that I included here are out of date now because those were taken like a couple of weeks ago, and the terminated grants have shifted since then as they're different every day. So that is always being updated. For your second question about the indirect cost losses and assumptions that are underlying that, we are assuming that that money is not actually going to be reinvested in new NIH projects, as DOGE initially claimed. Our rationale for that is that when the White House then proposed their budget for NIH, they did not reallocate that money. The idea was that that indirect cost cut would be imposed and that money was no longer in the budget. So it is not being put towards new awards. It does seem reasonable to think that their intention is that it would not actually go towards funding new or different awards. Other things about the process there and the assumptions, essentially our process is we take these direct loss estimates based on like what money would be disappearing. We then multiply it by that economic impact multiplier coming from United for Medical Research, 2.56. And then we integrate that with data from the US Census on commuter flows to account for where Americans tend to live and work, to sort of spread out a little bit beyond individual research institutions to look at how these might have downstream effects on surrounding counties or economies.
Thanks for the talk. That was great. I'm curious about your website analytics. Like, do you see equal engagement across states from people, or like, is there already like an inherent bias that people that are already interested in this work are more likely to do it?
That's a great question. Yeah. So first I'll note, I know this isn't quite what you asked, but in the prolific studies, the first two experiments with paid participants, we actually did get people from all 50 states in both studies, which is great to see. Of course, there are differences in numbers because there are huge differences in like state population, but it is nice to see that those actually were quite nationally representative. For the website data, I have not checked the latest. The last time I did this analysis was like a couple months ago. We're still collecting data, but I haven't looked at it recently. We are seeing people from all over the country and even from outside the US who are interested. I would expect that there is not equal engagement across the country, as we know that there are population differences, but also differences in terms of like density of research institutions. So I imagine that people who are in an area that has made this issue more salient for them are probably more likely to engage with the website. One thing that we're interested in doing as we move forward with this would be thinking about how we can design like social media ad campaigns to motivate information seeking among people who are not already voluntarily seeking out this information, which could include trying to promote engagement or get this information out to people who are in areas where they're not already encountering this kind of information, like in their local newspapers or in their daily life. In the back.
I think of how we get information today, and thinking of how information to make decisions all the time. So I think we're understanding better now that there's like disinformation
Mm-hmm.
put out into that negative, like discourage action, just a poison topic altogether. And here it almost seems that the way that study was designed is like, kind of very neutral, just sober information on like antidote to how to often correct information.
Mhm.
So how will you possibly do that to inform how to share this information broadly to kind of give more than antidote to more people?
Yeah, I'm glad you asked. Some of my work does look at misinformation effects on beliefs and ways that we can correct misinformation. Broadly speaking, I think of this problem of misinformation and disinformation online as being kind of a seesaw. So on one end of the spectrum, we have the problem of the misinformation that is spreading. We can do things to try to counteract or correct that misinformation. But on the other end, there's the truthful information. And we can think about ways that we could promote the spread or increase the effectiveness of the truthful information in order to balance out or counteract that misinformation. So we're currently focusing more on that end of the spectrum. So we're providing this truthful information in a way that we've demonstrated is effective and compelling. How can we now motivate people to engage with it and to share it broadly online so that it can sort of outcompete false claims that might be circulating? We also try to make sure that all of the information we provide is very transparent. So we're very clear and public facing in terms of our methods, our data sources, and everything like that. All of our data and code are publicly available and linked on the website. So we try to protect ourselves against potential attacks or other false claims by making it very clear, where our estimates are coming from and how we do what we do. Mhm. So misinformation is often considered sort of a broader umbrella term that would be any information that is false, regardless of the intent of the person who put it out there. Disinformation generally refers to a subset of misinformation that was intentionally crafted to be false and to, change beliefs or motivate people to engage with it in a particular way. So it's more of the intentionality of whoever put it out there. Yeah.
What do you think is like the mixture of different kinds of groupers out there? Like, and there could be people who are just forward the way. There could be people who really sort of feel like they get something out of it, right? And I was curious as to sort of how you think about that, and also the extent to which you can get deeper insights into that.
Great question. Yeah, I absolutely think there are subgroups within the bucket of people who initially approve. Some of them might have very low information about it. They might not be sure about the details of what's been proposed or what the projected effects are. They might instead say that they approve based on higher level, like for example, social identity cues. Like if you have a political coalition, you might not know everything about a particular policy item, but if you know what generally people in your in-group think, then you would already have an attitude towards it. So that's one category of people who might approve. But there are others who might be very informed and have looked into it a lot and might argue that, this is important. We need to pull back in terms of science funding in order to put that money elsewhere. And there could be a third category of people who approve of these cuts because they have misconceptions or certain beliefs about the process of doing science. Like they might believe that scientists are corrupt, that scientists are, putting out false information because they're incentivized to do so to get money, that science needs to be reformed in some way, and that this is part of that reform process. One way that we're looking at how we can sort of subdivide those groups or tailor interventions is with some open-ended questions that we included in our studies. So at the end, we ask people some questions like, okay, if these funding cuts were implemented, where do you think the money would go? And do you think that would be good or bad, or why? So we have some open-ended text responses from people. Of course, text data are messy to work with, but we're still working through that, and that will certainly inform future studies that we do, thinking about how we might be able to tailor messaging to particular groups to address concerns that they might have. All right. So it is almost 1. Do you want to try discussion? Let's try it. All right. If anybody needs to leave, that's okay. I have a few discussion questions. I'm envisioning that we can just have some informal chats at our round tables, and I will circulate to listen in and see what people think. So number 1, I listed a variety of different action suggestions. Are there any of those that resonate with you that you would feel interested in engaging with? I'd like to put out this open question of how members of this scientific community here can support each other during this challenging time. Many of us are experiencing job insecurity or grant terminations, as well as just sort of general ennui regarding the current funding environment. And a final big picture question. Traditionally, academia, particularly in STEM, does not explicitly value or incentivize effort that people might spend on communication or outreach efforts. So how might we reimagine this model? Can you think of any ways in which we might try to do more to acknowledge and support this kind of work in order to facilitate public engagement with science and understanding of science, and perhaps support our cause in the future or prevent the kinds of understanding gaps that we might be seeing right now? So I'm going to leave these questions up. We have this room until 1:30. If you need to go, that's okay. But for those who would like to stick around and discuss, go ahead and I'll circulate.